Namaste dear friends. So here we both are together here again, and today we are going to cover the series of your standing poses, their alignment and adjustments, right? Their alignment and adjustments for the type of different bodies, what are the props which you can use at the need of the individual. In the previous lesson we have discussed about the basics, what is yoga poses, how it has to be aligned, and what is the need of the alignment that we have discussed, that we have to maintain the structural integrity, that maintain the alignment of the bones in one line so that the body can work easily and it can functions easily into the yoga poses, and you can gain maximum benefits from the poses. We have discussed about the plumb line in the last class, from the side view, the lateral view, which you can check from the center of the earlobe to the center of the shoulder, center of the pelvis, center of the knee to the center of the ankle. Then we have discussed about that our main focus is for the individual alignment, not the universal alignment. So here, according to the body, you can change the alignment. According to the different tightness of the muscles, we can change the alignment. So then there will be no extra pressure of any part of your body, and the breath can be easily flow inside your body and you can enjoy your breath by yourself. So today we are going to discuss the first pose, that is your favorite pose maybe, I don't know. Sometimes it has to be more difficult to the person, the chair pose. The chair pose that you call Utkat Asana. So the chair pose, what is the name of the pose? Chair. And most of the time nowadays we are civilized to the chair jobs. So I think this pose will be easy for everyone, because every day you sit on the chair. This pose is easy or not? No, it's not easy, because that chair which we are going to make now, that is in a different way, right? That is not the chair which you sit, and that is not the comfortable chair. Maybe this is the chair which we have to use the every muscles to strengthen your body. The standing poses connects. If we turn our attention to the philosophical aspect, if we turn our attention to the psychological aspect, as we have discussed earlier in anatomy classes, this standing poses, what it gives you, the grounding. And when you can ground, guys, when you can ground, when you are present here physically and when you are present here mentally too. If Mr. Sobit is present here physically and is present here with the mental level somewhere else, so the pose has to be grounded here. So grounded, it gives you the grounding that I am here, I am present with myself. It gives you the stability. If I ask you guys, when you are in this pose, Tadasana, and close your eyes for a while, if I ask Sobit to close your eyes for a while, Sobit, so you can see the grounding and the stability of Mr. Sobit here, right? But if you ask the random people, just choose randomly anyone and ask them to stand into Tadasana and close your eyes. The person who came from the office and something is going on the mind, ask them. They always feel one sway. There is a sway in the body. So grounding or stability is not here. So that can explain, guys, to you, open your eyes, that can explain to you how much grounded you are. Are you present here physically, or are you present here mentally, or are you present with both? So these posture, we must have to know about that, which type of posture, the category of pose which I am going to practice here, what it gives me. Yes, physically everywhere it's written, these standing poses strengthen your quadriceps, strengthen your core muscles, strengthen your shoulders, strengthen your neck muscles, give you more stability. This we know. But we just not have to be explained the physical benefits. We have to explain the physiological, psychological and the emotional benefits to these category of posture. This is the main thing. Yoga is not just for physical asanas. We have to combine everything in every aspect to balance and get maximum benefit for each category of the poses and different level of your activity of daily living. So here we can say 3 variations you can use, 4 things. Every time you must have to know about the 4 things. 4 things always remember, guys. How to come into the pose, how to stay into the pose, how to feel the pose or how to enjoy the pose, and how to come out. If you know about these 4 things, you can make any pose for everyone. You can make any pose for anyone. There will be no harm, no discomfort, no injuries, and just balancing on the poses you can feel easily. So here I am giving you one simple example. Like beginners, Shobit is a beginner, and a beginner comes to your class and you ask them to go to the chair pose. Must have to be know first and foremost from where the pose has to be come. People have different commands. Yoga teacher has different commands, but how you make your command differently in your classes so the person can gain maximum benefit from the pose, not from you. So how you come to the chair pose, Shobit? So Shobit has a good flexibility, has good practice, he can do easily, right? But if we talk about the beginners, how to train the beginner, this is the first most thing. Just come out of the pose, relax. So for beginners, if you are teaching, right? For beginners, if you are teaching, you never have to ask that go that much down. From where the pose has to become, this is the first thing which we have to know. So for beginners, what they try to do, they always try to throw the knee first. This happens. Now you can see how much pressure you are feeling now. Yes. So there is a pressure, right? And there is no strengthening of these muscles of the beginners. So here nothing is happening. If I ask to sit down now, can you feel more pressure on the hips? Yes. More pressure on the lower back? So that's why, because of this wrong alignment, it affects your hip joint, it affects your lower back too. Isn't it? Relax. Come back to this Tadasana. Now simply I am giving an alignment to my student and command to my student, just place your 2 fingers on the front part of your hip bone. Front part of your hip bone where you feel it is we called ASIS, anterior superior iliac spine, right? ASIS. That will cover more detail in human anatomy, just which you feel the most prominent part of the hip bone from the front. So I never ask the student that throw the knees first, because the chair pose comes from the hip joint, not from the knee joint. Always remember this. So just try to press this and go backwards. Sit from here, sit, stop here now. Now any pressure on the knee joint? No pressure is here. So come back. So just place your fingers here and try to push this backwards. Sit more now, sit down. Very nice, that's it. Now you can see, can you see your toes from here, Shobit? He can see his toes. So here my client is sitting, now bring your hands up. For the back, I have to ask, just push your belly towards the spine. Right? Push your belly towards the spine. Neck elongated, lengthen. Shoulder blades squeeze together. So this is for the beginners you can make. This is one thing, how to come into the pose. That is knee. You don't have to move from the knee. Don't throw the knee forward. It creates pressure. It grinds your knee joint. And so many soft tissues are there. So maybe cartilage destruction, maybe meniscus compression, ligaments get here and there. So ligament sprain. This is, I only explained you right now from where we have to move. Relax, brother. Second thing which I am giving you the modifications now. Very simple modification if I ask you guys, very simple, that if you go to the word chair pose, what we say? Chair pose. So the chair pose can become from the chair too. So we can use the chair also, right? We can use the chair for very beginners, like this we can use with the person who has any injury or imbalances on the knees and on the hip joint. So brother, please sit here. This is the chair, right? If I feel, you can see this alignment of the knees, it has to be 90. In the chair you could not do this, wrong. Again the compression of the knee joint. So ask the person that maintain the 90-degree alignment on your knees too. Then just only simply we ask the person to put your hands on your waist here, that's it. Now stand up. Just stand up, that's it. Stable. Are you stable here? Bring your hands up. The chair pose comes from the chair easily, and if you feel the problem is in the muscles, so place this block between the thighs. In between the thighs, you can reduce the gap also if you want, right? Squeeze the block. So quadriceps, this muscle has to be active, right? This muscle has to be active. Pelvic back slightly, shoulder blades engaged, neck relaxed, and look at your eye levels, and these muscles has to be engaged too, so that you can strengthen and engage your forearm muscles, arm muscles, so there is no more extra load on your shoulder blades and these neck muscles if you engage this. If I ask my client, release these muscles, see pressure is coming here, yes or no? Yes. Simple. A micro maladjustment can change the whole scenario of your pose, my dear friends. So here, when my client is engaging these muscles engage, can you feel, you see, this is I need. You can check this way, muscle has one strength so that it creates less pressure on the shoulders and the shoulder blades too. So this is the one modification which we can use. Release, brother. Thank you. When we remove this chair now here. So next thing which we are going to more simple way, like with a person that comes after 50 or any injuries, severe injuries is there, then we go with the wall, right? Then we go with the wall, just take a little bit distance, just bring your ankle slightly forward so there is no more compression on your lower back, and just slide, hold. Knee has not to be crossed over the ankles. The person after 50 and any knee injury, previous existing knee injury, knee replacement, hip replacement, or any spinal surgery with the hypertension, must have to follow this instruction, my dear friends, to take yourself in a safe side. So here, back supported. Why I am doing this pose here? So that in the older age or before any previous existing injury, we can maintain the strength of these muscles, right? We can maintain the strength of our lower body muscles, our core muscles, our spine, just to activate them, right? Here we are not going to tone these muscles in a very large way like in a gym. We don't have to isolate every group of muscle, just to strengthen them so they can feel pain-free life. So here we can say, now just bring your hands up. Here we go. And for the neck, just support it here. Just try to, here we have to focus that this rib cage cannot be pointed forward. So slightly bring it, very good. That's the pose. Here you can see that you can do. Here also, if you want that, you can use the block, squeeze it, lift your toes up, brother, lift your toes up, muscle. Can you feel the engagement here, Shobit? Yes. So it strengthens your quadriceps. That is the group of muscle that we needed to strengthen the standing poses. So standing poses has the benefits that strengthen the what? Quadriceps. And that is helpful to maintain for the walking, standing and sitting. So this is the variation which we have discussed with the wall. Now the third thing which I am giving you guys, like, there is a one myth which you have listened so many times. People or the teacher always ask, in this chair pose, the one command I have heard so many times, tuck your tailbone in, tuck your tailbone in, tuck your tailbone in. Have you ever focused that tailbone is the base part of the spine? Right? The tailbone is the base part of the spine. And we don't have to overforce the bone because it is the passive structure that is responsible for the stabilization. It is not for the movement. It is not for the hyper movement here. A very small structure which doesn't have any movement. It is fused together. So if we look at from the back side, just go for the chair pose, brother, right? If the person who is in high arch, and if I ask, go slightly more up, yes. If I ask from here down, slightly down, down, go down, good. If I ask tuck your tailbone in, tuck your tailbone in, tuck, what is happening? See here. And for the beginners, he knows how to tuck it, so he is going very slowly. Like suppose you don't know about the tailbone, just try to throw it the pelvis forward. See what is happening here, how much pressure you can feel here now. So rather to use the command has to be more simple and clear to the student for the beginner level. Beginners doesn't know where is the tailbone and they always try to do this movement, tuck your tailbone in, they do this, extra pressure. We have to use the muscles, guys, right? We don't have to overforce the bone. If you are putting the force more on the bone, muscles get inactive. And there will be no tone on the muscles, and always you try to force the tailbone inside and it releases all the pressure from the muscles and bring the pressure to the bones, and whole spinal column, whole lower body has to be affected. So just we have to bring the attention for the beginners that change the command only. Nothing. We are moving, but moving in a one good manner. So here you can see now, if we see from the way, just go to the chair pose again. Suppose you have a high arch on the lower back, this, and tuck your tailbone in. See how much pressure he is putting here, release. So simple command, high arch on the lower back. You have to ask, or not high arch, just for the beginners also you have to ask, just simple command. What you have to ask? Push your navels towards your spine and see the lengthening of the spine. Can you feel the muscles here, Shobit? So push your navel towards the spine, rather to tuck your tailbone in, release the command. We have to engage the core muscles so that no pressure on the tailbone and the pelvic comes to the neutral position. Right? Again I am showing you from the another direction, in the front direction. So what I am asking to Mr. Shobit here now, that push your navel towards your spine, push, yes, this is C. You can see, just release, pelvic forward, push your navel towards the spine, push, pelvic goes automatically in neutral and no pressure on the tailbone. So this modification you can need also. Here also you can use the block in between the thighs if you want to activate who has a weak knee muscles and any knee pain. So these are the modifications, guys. Relax, brother. These are the modifications which you can use for the beginners, for the intermediate, for the advanced people. It is very easy. So just according to the level of the student, move through that. So you can feel first day, person come with a back pain in a less way, next day more or less, third day more or less, fourth day no pain, and you can move from beginner to intermediate. After 10 days, intermediate to the advanced, and then the person can also feel, yes, I am in a right place. So enjoy that pose, modifications with your near ones, dear ones, and give some healing effect of the chair pose to this world. Thank you so much. Namaste.